So I get a lot of questions asking what exactly men's pelvic health physical therapy involves, and we do treat men. I don't consider myself a women's health physical therapist. I'm a pelvic health physical therapist, and that's because I treat both men and women, because men and women both have pelvic floors. Now, the anatomy looks a little different on a male versus a female. This is a female pelvis. There's a vagina. Men don't have vaginas. However, we have the same muscles. These muscles that sort of surround the vagina in women actually form the shaft of the penis in men. So while the anatomy looks different externally, we have the same muscles and they work in the same way in men and women. So there are times when a man might need a pelvic health physical therapist to help with things like pelvic pain, penile pain, testicular pain, post-prostatectomy. Often they have incontinence issues, pain or erectile dysfunction. You don't have to have prostate surgery to be dealing with those issues, so we treat those issues in men who have not had issues with their prostate as well. And then also we deal with bowel issues, and both men and women have bowel dysfunction, so constipation or fecal leaking, excessive wiping after you have a bowel movement, difficult bowel movements. All of these can happen in men or women, and so we also treat men. The major difference is that if an internal exam is warranted, obviously in a man, we're going to immediately jump to rectal exam because that's our only option in terms of internal exam. Whereas in women, we tend to have, we have the option of doing vaginal versus rectal, and that kind of is something that you talk to your PT about, and you guys would make that decision. But obviously, since men don't have vaginas, it's a rectal exam, and that's how we do our treatment as well if internal work is warranted. And just like in the video I made about pelvic health for women, we actually don't spend the majority of our time in the rectum or the vagina. Yes, we get a lot of information if we do an assessment internally. It tells us a lot about what's going on with the muscles and the muscle function and coordination. It gives us a really clear path in terms of treatment. But we're working head to toe. We're working on a lot of other things. We are not spending an hour doing internal work or internal assessment. It's a small piece of the puzzle. It can be a very important piece, but again, there's a lot of tools in our toolbox that don't involve internal exams. So, I hope that helps maybe take some of that anxiety about finding a pelvic health therapist. And certainly if you're having any issues with leaking, constipation, bowel movements, erectile dysfunction, pain, and you've seen other providers, it might be a nice one to add to your list, because we're looking at very different things than the urologist, than the GI doctor. They're looking at really important things. We're also looking at really important things, but we all have our specialties. So if you haven't been assessed and you're having any of those issues, it's worth collecting that part of the puzzle and kind of putting that into the big picture. And it is not stressful, and our goal is to make you as comfortable as humanly possible, and make sure that you feel safe and confident in our skills and in the treatment that you're getting. So if you have any questions, please don't hesitate to send me a message or follow me on Facebook or Instagram, and you'll get some information there. And if you need help finding a pelvic health physical therapist in your area, I am happy to send you the link to help you connect with somebody in your area if you're not in Fayetteville area. Okay, if y'all have any other questions, let me know. Hope you guys have a great day.